Welcome back to the Aig-Imoukhuede Foundation podcast, where we delve into innovative initiatives and solutions that are driving positive change across the African public sector. My name is Ofovwe Aig-Imoukhuede, co-founder and executive vice chair at the Aig-Imoukhuede Foundation, and I will be your host for today's podcast. At the Foundation, we are on a mission to transform lives across Africa, and a big part of that mission is ensuring improved access to quality primary health care. Welcome back to the Aig-Imoukhuede Foundation podcast, where we delve into innovative solutions and initiatives that are driving positive change across the African public sector. My name is Ofovwe Aig-Imoukhuede, co-founder and executive vice chair at the Aig-Imoukhuede Foundation, and I'll be your host for today's podcast. At the Foundation, we're on a mission to transform lives across Africa, and a big part of that mission is ensuring improved access to quality primary health care. Primary healthcare centers in Nigeria constitute 85% of health facilities in the country, and only about 20% of these are functional and can provide basic emergency obstetric services. Research shows that 75% of PHCs in Nigeria do not have the minimum required equipment package, including essential medicines and personal protective equipment. We understand that a healthy population is the foundation for a productive society, and that by fostering public-private partnerships, we aim to close the gaps in healthcare delivery to ensure that more people, especially in underserved communities, have access to essential medical services. Today, we're going to explore the viability of public-private partnerships as a transformative model for improving healthcare access in Africa. Our flagship healthcare initiative in the Foundation, the Adopt a Healthcare Facility Program, is a strategic collaboration between the government and private sector stakeholders specifically designed to revitalize primary healthcare facilities across Nigeria. Joining me today for this conversation are Dr. Tinuola Akinbolagbe and Dr. Ola Brown, two experts in the healthcare innovation and sustainability field. Together, we will discuss how innovative initiatives leveraging PPPs in Nigeria have achieved significant successes and discuss possible strategies to enhance the collaboration between the private and public sectors in the country.
Fantastic. Thank you so much. It's such a great question to be sort of looking at my experience from the UK, where sort of I grew up and had all my education, to Japan, where I did my clinical fellowship, and then moving from Tokyo to Lagos. And my sort of earliest contacts with the healthcare system in Nigeria came when I was actually in my second year in medical school. So like I said, I didn't actually grow up in Nigeria and had no contact with the healthcare system until I was sort of almost halfway through my training. And it happened when my sister fell critically ill when she was on holiday in Nigeria. From the UK, we tried to support as best we could as a family, but we quickly realized that even things I had the ability to sort of mobilize and catalyze as a second-year medical student was so difficult to get done in Nigeria, even with working with quite senior professionals. And I think that was what kind of radicalized me into moving to Nigeria to try to solve this problem of healthcare and try and close this gap. One example that I sort of cite when we're having conversations like this is just the amount of spend required for healthcare systems across the world. So when you look at a country like Norway, for instance, that has, one of the best healthcare systems in Europe, they spend about $7,000 per person on healthcare. The UK NHS spends about $4,000 on healthcare. The American healthcare system, one of the most expensive in the world, they have a population of 300 million people, and their spend per person on healthcare is $9,000. But when you come into Africa, you see figures like $1, $2, $5. So the question for African policymakers in the healthcare space is, how do you do even close to, or provide even close to the equivalent standard of healthcare with $3 or $1, as the Americans do with $9,000? And to just bring it into sort of macro figures, the healthcare NHS bill for the year, in terms of budget, is over $200 billion. In Nigeria, the federal budget for healthcare is $1 billion, which means that if, out of the generosity of their hearts, the UK healthcare system gave us their budget for 1 year, it would pay Nigeria's budget for over 200 years. So when we're having these conversations about the quality of healthcare and how to improve the quality of healthcare, we have to look at it from an economic lens first. But there's also the clinical lens, just the number of practitioners available. So again, using the NHS as an example, there are 28 doctors for every 10,000 people in the UK, compared to 1 in Nigeria. And probably less than 1 if you look at the statistics of registration versus actual doctors practicing. In some parts of Europe, that number is 41. So the question is really, how do we do more with less?
Thank you very much, Dr. Ola. Those are some startling statistics. $3 per head versus 4,000, 6,000, 9,000. This is a huge gap that we have to fill. Dr. Tinu, this question is for you. Do you think that the Nigerian or even governments across Africa can handle this alone?
It's great to be here. Thank you for having me. And your question is quite instructive. So the short answer is no. There is no way that the government in Nigeria or any other middle to low income country can handle the requirements of the healthcare system. It's just a matter of prioritizing, because we have so many competing priorities for our very limited resources. There's so many issues with our healthcare system. If we look at infrastructure, that's an area that we have inadequate infrastructure. We're talking about healthcare infrastructure, but even basic infrastructure, road network, a transportation system, IT network, power. Those are things that in most climes you take for granted, but that is something that every healthcare provider, everybody that delivers healthcare, has to take into account as well. So an effective way to combat this would be through effective public-private partnerships. And in this way, we can leverage investments from the private sector to be able to build and upgrade healthcare facilities. And this would share the financial burden and help to speed up development, particularly in the rural areas. There are ways that we can have some type of sharing arrangement to encourage the private sector to go to the rural areas as well. So even our data, our healthcare information is faulty and we're unable to plan effectively. And then, of course, the elephant in the room being the shortage of medical personnel. We've had significant brain drain in Nigeria, even though we actually started off with low numbers to start off. From inception till date, the Medical and Dental Council of Nigeria, we have less than 50,000 registered medical doctors in Nigeria from when they started keeping those records. And close to 50 to 70% of those are no longer practicing in the country. If we add the numbers of those that trained in the diaspora, on paper, we can get to 100,000. But effectively practicing in Nigeria, I think we have between 20 to 30,000 practicing doctors. That is not a number that makes any sense. When you look at the WHO ratio, the recommendation of 1 to 1,000, 1 doctor to 1,000. So the private sector can support on that, helping with capacity building and what have you. So based on that, the private sector can contribute and bring a lot to the table. So in conclusion, I think we need to have a multi-stakeholder approach where both sides, the public and the private, bring their areas of expertise to support the government, to the private sector, the private for-profit sector, the non-profit sector, and then together we can transform the Nigeria healthcare system.
Thank you very much for that, Dr. Tinu. And just speaking on PPPs and collaboration, can you briefly tell us about the Adopt a Healthcare Facility program that your organization champions, how it started, what the objectives of the program are, and how you plan to build sustainability into it?
Thank you. So the Adopt a Healthcare Facility Program, ADHFP, it's an exceptional initiative which we came up with at PSHAN. So the original concept came from one of our directors, Mr. Ofovwe Aig-Imoukhuede, and the objective is to have a functional, world-class standard, global standard primary healthcare system, and build a center in each of the 774 local governments of Nigeria. So the PHCs are the backbone, they're the foundation of healthcare systems. And so if we have one in each of the local governments of Nigeria, then there's a foundation and there's a best of purpose brand, which can be used as a model by the state governments, by the local government. The program is both a financing mechanism and it's also a healthcare project. So the main thing that we have is we want to rebuild the public trust in the efficiency and effectiveness of Nigeria healthcare system. You'll find a lot of people no longer attend public healthcare centers. They don't go there. They say they go there, the doors are locked, there are no personnel, there's no medication. There's always a problem. So this serves as an innovative financing mechanism for funding, to provide funding. And very important to note that this is not a for-profit venture. So any income that is made is plowed back into the system. So the objective is to have widespread impact, which was why we selected all the local governments in Nigeria, because even in Lagos State, you have rural areas. People tend to forget that even in the cities, you have the slums, you have some areas where there is difficulty accessing healthcare. We also found that it's a way to engage the private sector to contribute meaningfully. So far, we've managed to get commitments to the tune of 20 billion. That's a very large number in Nigeria. And with that, we will be able to, we're looking at having close to 100 ready for deployment by the end of this year. And we're working with major private sector players. The focus for primary healthcare, as I mentioned, is because that is the foundation of the healthcare system. But we have problems, particularly in maternal health, neonates, child health. That is an area of focus for us. Also looking at things like HIV, tuberculosis, and even with the advent of non-communicable diseases, we're having a lot more hypertension, diabetes. These are all things that can be handled at the primary healthcare center, at the primary healthcare level. So we can help to build capacity of the healthcare workers there, and enhance their ability to be able to provide care. And then it's also easy for us to find a way to measure the impact of our intervention. We have great statistics so far for the centers that we have up and running in Delta State and in Bauchi State. And this is a solution that is scalable, that is easy for the state governments to replicate. So for every center we put up, it's possible for the state government to do the same and build a model center. And then the ripple effect of that is something that we expect to see very soon. Thank you.
Thank you very much for that, Dr. Tinu. When you say that the state government can replicate, it doesn't really address the funding gap, though, does it? Dr. Ola, you founded a company called HealthCap Africa. Can you talk a little bit about the objectives of the company, what you hope to achieve, how you hope to contribute to healthcare access, and then discuss the financing side of primary healthcare? Thank you.
So when I moved to Nigeria, the first company I started was called Flying Doctors, and it was in emergency care because my background was really in acute and emergency care. I didn't know very much about healthcare in general and had sort of focused on acute care. We scaled that company to be able to serve 40 countries across Africa. So I got a good perspective of the overall African healthcare setting. We're responding to 5,000 emergency calls every single year, and providing ground ambulance, air ambulance, and emergency medical assistance services across 40 countries in Africa. So that gave me, I guess, perspective on the business aspects, which is the private sector aspect, and also the financing. So when I had a liquidity event from that company in 2016, which was the first time I got a large amount out of the company, I started to think about what to do next and how to really focus with a wider lens than just emergency and acute care on healthcare. And that's when I started noticing something different about Africa for healthcare, because if it was possible to leapfrog over legacy infrastructure like bank branches in America and Europe and go straight to mobile money, then perhaps there was a way that we could use the same sort of thinking and strategy to perhaps leapfrog over some of the infrastructure needs in Africa. So we founded HealthCap to invest in venture capital in Nigeria, Kenya, Egypt, and South Africa, and really look for innovative technology solutions for Africa's most gritty and hardest healthcare problems, and looking to see if we could create the same kind of technological innovation that was seen in the banking sector as in the healthcare sector. And we've already invested in 16 companies across Africa, some in the space of diagnostics, some in the space of telemedicine, some in the space of EMR, some in biotech, some in pharmaceutical distribution. And what we've started to see is that African young people actually have a comparative and competitive advantage when it comes to building technology products. And actually, these products might not be able to work as efficiently in America because of the legacy issues in terms of regulation and red tape and existing structures, whereas these companies are able to scale rapidly across the continent at 1% or 2% of the cost of their legacy equivalents. Now, I'm not saying that they eliminate the need for physical infrastructure, because while I can make a bank transfer on my phone, I can't take out an appendix on my phone. We still need surgical theatres, we still need physical infrastructure. But when we're thinking about reducing the cost of healthcare, we must be able to leverage technology, which is, I believe, one of the areas where African young people do have a competitive and comparative advantage. So that's really the story from Flying Doctors to HealthCap. Like I said, we've invested in over 16 companies so far. We will invest in 50 by the close of our fund. And they've already created 1,000 jobs. They serve our portfolio companies together serve 1.5 million people. Patients across Africa and across 8 different countries. So already you can see the huge impact of just a few, mainly tech companies and technology-based companies to really make a difference to now millions of patients. Now, when it comes to collaboration between public and the private sector, which is really the crux of this conversation, one thing that I'd want to start by pointing out is that there's no country on the face of the earth today that has achieved universal healthcare without the public sector. So the public sector and public sector financing is of huge importance when it comes to providing healthcare. But I do think private sector financing is important. And I'll explain why I think that. Number one, in Africa, our public sector is very constrained. In my last response, I said that the NHS budget is over $200 billion for just healthcare in the UK for their population of 60 million people. I think the 2024 budget, if I'm not mistaken, was about the whole budget for Nigeria was less than $30 billion. So the NHS budget actually is not just more than Nigeria's healthcare budget, it's more than Nigeria's entire budget. And why I'm talking about the whole budget is because, of course, it affects healthcare. And it means that we have a much lower amount to dedicate to healthcare. And that's why I think the private sector has to be far more innovative when it comes to structuring finance, both for healthcare technology and also for healthcare infrastructure.
Interesting. So, what kind of innovative financing models have you heard of that can be applied in the Nigerian context?
This isn't something that we have to reinvent. We don't have to reinvent the wheel. If you look at Turkey, for instance, they had a sort of massive PPP rollout, which was successful, in collaboration with the World Bank, where they, I wouldn't say are in a similar situation, but it's a situation that can be applied for Nigeria, to Nigeria, in terms of the fiscal layout, the budget, an emerging world economy. There are similarities between Nigeria and Turkey, at least more similarities between Nigeria and Turkey than Nigeria and the UK. And they were able to crowd in huge amounts of private sector funding under a PPP model to be able to meet some of these financing needs in a more sustainable way. But I think it's important, whilst we're building physical infrastructure, to also think about digital infrastructure, because this is a way that I think Africa can lead. And I think that Nigerians and Africans in general have shown that we have a competitive and comparative advantage in building really rugged, robust, low-cost technology products. And I think that this can help us bridge that financing gap. So 2 solutions I've mentioned. Number 1, being able to leverage on technology to try and bridge the gap. And number 2, being innovative about the way that we leverage private sector finance to build our infrastructure, bearing in mind our budgetary and fiscal constraints and using countries that are sort of, I guess, comparable to us, like Turkey and Egypt as examples.
Thank you very much, Dr. Ola. A lot to unpack from your response. Clearly, using technology to leapfrog over some of those gaps is essential. And in other countries, as you mentioned, like Turkey and in Egypt, it has become evident that the private sector has a massive role to play in closing some of these funding gaps. Dr. Tinu, this question is for you. The Nigerian private sector is very competitive. There are lots of entrepreneurs doing great things. There's lots of funding available, lots of resources available. And given this huge gap, there's a massive market for private sector funding to intervene in the healthcare space. But what is needed, and I think what is available in the countries that Dr. Ola mentioned, is an enabling environment. So, for PPPs to really work, the government also has to be on board, and they have to create the right policies, the right frameworks that would give private sector entities, not just philanthropists, but people who are in it to make a profit, comfort. So given your experience operating in this space, what are the challenges that you have faced working with the public sector and developing this Adopt a healthcare facility program initiative, and looking at it from a for-profit perspective, what do you think are the key factors that the public sector stakeholders must address to unlock the full potential of PPPs and healthcare innovation?
Thank you. That's a great question. It's a huge question, but it's a great question. I think we need to understand or recognize that our health system, our health ecosystems are very fragmented. So you have different things going on at the federal level, at the state level, at the local government level, in the public sector, in the private sector. Really, it's like everybody's doing their own thing, pulling in different directions. So it's very important to have some type of coordination and alignment of objectives. When you have multiple stakeholders, all with different objectives, you need to carefully coordinate and align what it is that they're doing. So you have those that, as you've mentioned, are there for profit. Those are really important stakeholders to engage because they're going to be there for the long run. You have also philanthropists, you have non-profit organizations, you have the public, you have the users, which is the general population. You must align everybody so that we're all moving in the same direction and at least have the same general overarching objectives. So that is so very difficult, I must be honest. A lot of bureaucratic hurdles, a lot of regulatory complexities. When I used to work in the diagnostic sector in Nigeria, despite my best attempts, Nigeria was always classified as a VUCA region. I used to argue, and say, well, these things are stabilizing. Nigeria is extremely volatile. Our policies are uncertain. They're changing. They're needlessly complex in a lot of cases. And there's a lot of ambiguity. So I'll give you an example. Imagine as an investor coming and investing in bringing in syringes or different types of medical consumables, setting up a whole supply chain for that. And one day the government wakes up and says, we are no longer allowing people to import syringes. So in most countries, if the government is going to come up with a policy like that, there's lead time, there's advance notice. 5 years before it comes into effect, information is put out so that people can start to pull out the funds and build capacity internally. So for instance, that policy recently came out. It's yet to be implemented, but the government plans to implement sometime this year. And then you have only 1 or 2 entities in the country that are manufacturing syringes. It's a problem waiting to happen. So it's something that should be phased. It's something that should, go according to a certain, as you build more capacity for local production, making sure that the quality standards are what it is that is required. So there's a lot of flip-flop on the policy side from the government. Community engagement. All the members of the community need to buy in, need to take ownership to ensure that whatever intervention, whatever program is done. We've done that quite a lot at Pishan with the ADHFP. Before we go into any community, we first make sure that we map out the critical stakeholders and we engage with them. So this involves both the government officials, the traditional rulers, the youth council, the women's council, what have you, all those that make decisions, formal decisions and informal decisions. We have to carry everybody along to ensure that whatever intervention that we're deploying, we have their buy-in. Otherwise, they will frustrate the project. Sustainability, that is critical. Ensuring that we have strategies in place to ensure that intervention, after the certain number of years that we've committed to, continues to be maintained and continues to work. So we've looked at that and we work with the State Health Insurance Agency such that when we intervene in a PHC, we ensure that they are listed under the State Health Insurance Agency for that state. And so they're gradually building up the funds that are coming in. Remember, they still have their official allocation of funds from the local government, but the health insurance funds serve as a secondary source of funds. And if we build that up, after the period of 5 years when we've done our intervention and we're leaving, then that program becomes sustainable. So the ways that the government or the public sector at all levels can improve or help to unlock the full potential is to have some type of regulatory framework. So to be fair, the current administration, we've had some discussions with them in the Ministry of Health under the leadership of Professor Pate, and also with the presidential initiative for unlocking the healthcare value chain, that they need to come up with some type of framework that is, obviously it can't be simple, but it's somewhat plug and play. It's very straightforward, not complex. There's some guarantees in place. And with that, you then create an environment that is enabling and that encourages and welcomes the private sector to come and invest, because they're guaranteed that for a period of 5 years, for a period of 10 years, you'll be allowed to do this or do that. Financial incentives, we've had members of the finance sector in Nigeria approach us at PSHAN that they want to work with the government, but they do not want to go as individual financial institutions. And they've asked PSHAN to be the middleman, to engage with the government and say, what incentives can you put in place so that the finance sector is comfortable or is encouraged to be able to invest in local health projects. I think a very important thing also is transparency and accountability. Sometimes in Nigeria, the more you look, the less you see. So if everybody comes to the table with an open agenda and there's a fair degree of transparency and honesty, and there are no deals being done under the table, because we must be realistic, that's the environment in which we live, then you have that trust both on the side of the public sector and the private sector. So organizations like PSHAN serve as a happy medium between the two objective to ensure that everybody genuinely and truly puts their cards on the table. Those are some of the key things that I think we can put in place right away, low-hanging fruit, sort of to say, and that would really, really help to improve healthcare delivery in Nigeria. Thank you.
Thank you very much for that comprehensive response, Dr. Tinu. Clearly, a lot of work needs to be done from the public sector side. But I liked your reference to the role that PSHAN and philanthropy in general can play in acting as a middleman to sort of create levels of trust and comfort from both private and public sectors. Dr. Ola, so I will put this question to you now. I'm speaking to you as someone who is a healthcare investor for profit, obviously, and you have listened to everything that Dr. Tinu has shared about the potential that is there. What would give you comfort as an investor to engage with the public sector and to use some of that technology that the companies that you are investing in are developing to close some of these healthcare gaps?
Even in the UK, where the earnings are much higher, the government still needs to chip in a huge amount to cover the cost of healthcare. Even in America, where you're seeing 1 in 24 people in New York are millionaires, where you're seeing much higher levels of middle class, much higher levels of disposable income, 30% of that population still rely on the government. Now, in those markets, the government is building infrastructure out of their pockets and they're paying for services out of their pockets. Whereas in Nigeria, we're saying perhaps the services and the infrastructure, that capex cost that takes so much out of the budget, can actually be handled by the private sector if there was some sort of minimum level of footfall that the government said, you know what, we're going to sort of de-risk this project for you, and this is going to be the minimum foot level if you build this infrastructure, or this is going to be the minimum utility if we use this software. And I think that makes a lot of sense. And also, I don't want the private sector also to have or develop perverse incentives. So the public sector needs to set clear KPIs for the expectations of the private sector vendors. And like Dr. Tinu said, that process of selection of the best partners needs to be transparent and sort of in a way that people can see that there's accountability in the system. So if I was as a private sector investor, and I've spent sort of my entire adult life investing in Nigeria, either through my own business or as a professional investor, investing in technology companies, investing in entrepreneurs, supporting infrastructure projects. I would say for me to want to engage directly with the public sector, number one, as an investor, I'd like to be assured of sort of an accountable, transparent process. Number two, like I said, if we're going to serve those poor people, and most people in Nigeria are poor, if we're going to be able to serve those people that spend sort of now with food inflation, 80 to 90% of their income on food, they can't afford healthcare. They do need support. Then we'd have to be guaranteed a minimum utility for software or a minimum for infrastructure. And those would really be the two major things that would really help an investor looking at Nigeria to say this is where I would want to put my money, as opposed to India, as opposed to China, as opposed to Vietnam, as opposed to other emerging markets.
Thank you very much for that response, Dr. Ola. It seems that as a nation, we're quite far off from where we would be attractive to investors who are looking to dabble in the emerging markets. So that leaves a lot of space for philanthropy to take the lead. And initiatives like the ADHFP and the things that Pishan is working on come to the fore. Dr. Tinu, you've heard what Dr. Ola has said about private sector investing and the lack of attractiveness, and therefore creating this room for philanthropy to thrive and take the lead. However, the issue with philanthropic initiatives, like you had mentioned before, is the sustainability aspect. So how, if you were talking to a philanthropist and trying to encourage them to look at the Nigerian healthcare space as a potential area for them in which to invest in, investing in inverted commas, how would you sell it to them? How would you use the ADHFP initiative to sort of signal the possibility that philanthropic funds could make to healthcare access?
Just to highlight the potentials and the possibility that you have. During the COVID pandemic, we had an initiative in Nigeria called COVID, where the private sector worked to mobilize funds to support the government. And I think it was at that point that people realized the capacity of the private sector and how much of a difference that they can make. If I recall, the WHO mentioned that the COVID initiative in Nigeria, which was the coalition against COVID, managed to raise the third largest amount of money in the world, specifically for COVID. It was well over 80 billion, if I recall, Naira, not USD, Naira. But in terms of real money in Nigeria, it made a huge difference. So what we do is that the funds that we manage to raise, it's like a form of catalytic funding for the PHC system, as I've explained. So we work with all the stakeholders, and we work with international partners, local and national partners, to ensure that we build in sustainability strategies. So we're very particular partnerships, we sign agreements with everybody. It does take a lot of time, but this way we make sure that we carry along everyone right from the Federal Ministry of Health, the Nigeria Primary Healthcare Development Agency, the National Health Insurance Authority, and then at the state level, we sign agreements with the state government, with the State Primary Healthcare Development Agency, and with the State Health Insurance Agency. It takes a lot of time, but when we sign these agreements, it's such that it ensures that that program is sustainable. So every single thing we do, we involve them. So they take ownership as well, down to recruiting personnel to deploy at these centers. Remember that these personnel will remain employees of the State Primary Healthcare Development Agency and the local government area long after we've gone. So we involve all the necessary stakeholders to ensure that that understanding is there and that the transition is seamless after a period of 5 years when we leave. Policy advocacy, we engage in a lot of policy advocacy. We work with a lot of think tanks. We work with the NESG. We've had meetings with so many people to ensure that we present our brief to the government and that we can influence long-term sustainability for some of the regulations that govern the operation of the ADHFP. Also, monitoring and evaluation. We have a very robust monitoring and evaluation mechanism where we measure the impact, we track, and we present the data showing the impact, the progress that we've made in the centers. We're very pragmatic. We do understand that there are some areas that can be improved, but the only way we can find out those areas is by tracking the progress that we're making. Then we're very particular about knowledge sharing. So we take a lot of time to, we have webinars, we have podcast series, we have conferences where we give updates on what it is that we're doing. And we share this information so that others can replicate what we're doing using the best model, and we share best practices. Last year, we also started what we call the PSHAN Annual Gala and Awards, where we recognize those that are supporting us in our projects, in our programs, and even just making a difference in healthcare across Nigeria. Because we found that there was no neutral, objective body that could recognize innovation and those that are actually making huge strides in healthcare delivery in Nigeria. So we work across 5 categories for the annual awards. We work with the public sector category, private sector, non-profits, the media, because the media are a very key partner for advocacy, knowledge sharing, and general information dispersion around what it is that we're doing. And then also individuals. We work with quite a number of volunteers, because we mobilize resources. And for the private sector, resources are not just financial resources. We have people provide a lot of resources that are non-financial, provide their time, their expertise, their skills, and we deploy all this and we put it in place in such a way that long after the official intervention is done, those people will continue to support those PHCs and those programs, even within their localities. So we have people like retired nurses, teachers, judges that live in those communities and can continue to support those initiatives once we've put the framework in place for them to work with the PHC at that level.
Wow, sounds like you're doing amazing work at PSHAN, Dr. Tinu. Congratulations. But before we conclude, could you provide details on how individuals and organizations can collaborate with PSHAN on the Adopt a Healthcare Facility program to improve health outcomes and advance equity?
Thank you. So number one, through advocacy. We need you to help us to amplify our message, put it out on social media. If you have a platform where you can help to air what it is that we're doing, please help us with that. Adoption, obviously. You can adopt as a corporate entity, as an individual, or as a group of people. Adopt people, a PHC in your locality or far away from you. Volunteers. We need volunteers across many streams. If you're a professional in any way or you're just someone who's willing to help, we look forward to having you join our volunteer stream to help us to support these initiatives. And of course, donations. We accept donations in cash, in kind, and we do have a crowdfunding platform. You can check ADHFP.org to get more details. So we really do appreciate all the support we've gotten so far, but we always would welcome more. Thank you.
Thank you again. Thank you, Dr. Ola. Thank you, Dr. Tinu, for being our guest today. This brings us to the end of the discussion. Thank you to our listeners for joining us on this enlightening exploration of the role that PPPs can play in improving healthcare in Africa and the very important role that philanthropy plays as a connector and as a builder of trust and as a provider of resources. Leveraging shared knowledge and resources is a powerful way to improve health outcomes and access to quality primary healthcare in Nigeria. So we at the Aig-Imoukhuede Foundation are determined to play our role as a philanthropic organization connecting both the private and the public sectors to build better health outcomes for Nigerian citizens. We are a big supporter of the Adopt a Healthcare Facility program, and we believe that every single Nigerian with resources can also contribute to this project. So please visit adhfp.com to find out more information about how you too can play a part. Thank you very much. This has been an episode of the Aig-Imoukhuede Foundation podcast. Remember to subscribe, share, and leave us a review if you enjoyed this episode. Until next time, stay inspired and remember that together we can build a brighter Africa.